Hey everyone, I'm going to be talking to you about glucosamine, chondroitin, calcium, and magnesium for bone health. First, glucosamine is also known as glucosamine sulfate or glucosamine hydrochloride. It's typically administered orally and it's commonly used for osteoarthritis, inflammatory bowel disease, ulcerative colitis, and Crohn's disease. There is lots of research showing the effectiveness of glucosamine as a treatment for osteoarthritis. Several studies say that 1,500 milligrams of crystalline glucosamine sulfate given once daily can decrease the risk of radiographic knee injuries, can reduce pain, decrease the consumption of NSAIDs. A study in 2015 compared oral glucosamine to topical glucosamine. It found that the topical form was superior to the oral form in reducing knee stiffness. Not all studies show the effectiveness of glucosamine as a treatment. In 2002, Hughes and Carrs found that glucosamine was just as effective as placebo. Glucosamine and NSAIDs are very similar in reducing pain. The only advantage to taking NSAIDs is that it can reduce pain quicker than glucosamine. Joints are cushioned by the fluid and cartilage that surround them. In people with osteoarthritis, the cartilage breaks down and becomes thin. Glucosamine is an amino sugar that makes up cartilage. It stimulates the metabolism of chondrocytes in the articular cartilage and synovial cells. It creates building blocks for tendons, ligaments, cartilage, and the thick fluid around joints. Glucosamine sulfate is very important because it can increase the strength of the cartilage. Glucosamine also has anti-inflammatory effects. In vitro and in animals, glucosamine can decrease the expression of IL-1 beta and NF-kappa. It can downregulate the expression of cyclooxygenase 2 and MMP13 expression. Glucosamine is typically administered orally. A 1,500 milligram dose is given once daily or 500 milligram dose given 3 times a day. Be sure you're taking the sulfate form of glucosamine. There's a big difference between glucosamine hydrochloride and glucosamine sulfate. Glucosamine sulfate may be more effective than other forms due to the sulfate component in cartilage. Some labels state that glucosamine sulfate, but it actually contains glucosamine hydrochloride plus an added sulfate. Be sure to do your research on Consumer Lab before giving out a glucosamine sulfate supplement. Glucosamine is likely safe when taken orally and possibly safe when injected. Known side effects include nausea, heartburn, diarrhea, and constipation. The DNIs for glucosamine include warfarin. If warfarin and glucosamine are taken together, it can increase the anticoagulant effects, increase bruising and bleeding. Chemotherapeutic drugs can also be altered by glucosamine effects by downregulating certain enzymes that inhibit cancer's progression. Acetaminophen and glucosamine can also interact with each other due to their sulfate channels. These are 4 recommended supplements of glucosamine. Often, glucosamine sulfate is administered with chondroitin. 3 of these are Consumer Lab approved. Overall, I give glucosamine a green light. Glucosamine is very safe and affordable for a supplement for bone health. When recommending this to patients, recommend a dose of 400 to 1,500 milligrams to help clients alleviate joint pain, reduce inflammation, and slow the progression of osteoarthritis. Be aware of its interactions with warfarin and other drugs. Other ways to get glucosamine in your diet include consuming bone broth with chicken or beef, eating bone marrow, or shells of shellfish, such as shrimp, crab, and lobster. Next is chondroitin. Chondroitin is administered orally, topically, intramuscularly, and ocularly. It's commonly used for osteoarthritis, also various joint problems, cataracts, UTIs, and dry eyes. There are several research articles that show the effectiveness of chondroitin as a supplement for osteoarthritis. Chondroitin sulfate and glucosamine have been used for medicinal purposes for over 40 years. CS is recommended by the Osteoarthritis Research Society International for Management of Knee Osteoarthritis. In 2015, Navarro et al. Used 18 subjects and gave them chondroitin sulfate once daily. They found the CRP concentrations were 23% lower after supplementation compared to placebo. This shows that chondroitin can reduce systemic inflammation. In 2015, a meta-analysis by Cochrane Library found that taking chondroitin alone or in combination with glucosamine showed a statistically significant reduction in pain when compared to the placebo or active control. Chondroitin sulfate is a major component in the extracellular matrix and is in various connective tissues such as cartilage, bone, skin, ligaments, and tendons. It has anti-inflammatory effects. In vitro, it was shown to inhibit synthesis of inflammatory cytokines such as nitric oxide synthase, cyclooxygenase, and prostaglandin synthase. It can also reduce interleukin-1 and increase p38 mitogen activity. The inhibition of these inflammatory cytokines allow for the existing cartilage to not become further damaged. It also serves as a substrate for the formation in the joint matrix. For arthritis, a dosage of 800 to 2,000 milligrams is typically given to patients. Ensure that your supplement contains real chondroitin. Chondroitin is extremely inexpensive, and suppliers may sell a lower-priced synthetic chondroitin. See Consumer Lab to ensure you're taking an appropriate brand. Chondroitin is likely safe when taken orally by adults and possibly safe when used intramuscularly or intravenously. Reported side effects include mild stomach pain, nausea, bloating, diarrhea, constipation, headache, swollen eyelids, leg swelling, hair loss, skin rash, and irregular heartbeat. The DNIs include warfarin. If warfarin and chondroitin are taken together, it can increase the anticoagulant effects and increase bruising and bleeding. This is from animal cartilage, so do not recommend for vegans. Here are 4 brands that I recommend for glucosamine and chondroitin. Often those two are prescribed together. The 2 on the right of the screen, Whole Foods and Pure Encapsulation, are Consumer Lab approved. Overall, I give chondroitin a green light. It's safe and suitable supplement for bone health. When recommending to patients, it is within our scope of practice to recommend an oral supplement dosage of 800 to 200 milligrams to help clients alleviate joint pain, reduce inflammation, and slow the progression of osteoarthritis. Beware of its interactions with warfarin. A food source of chondroitin is bone broth. Next, I'm going to talk to you about calcium. There are several forms of calcium. Calcium carbonate is the most economical, but must be taken with meals, and it's not recommended for people with absorption issues. Calcium citrate is more expensive, but has increased bioavailability. Calcium supplementation is used for hyperparathyroidism, renal failure, hypertension, PMS, and hypocalcemia. When calcium is taken, only 1/5 to 1/3 is absorbed in the small intestine, and it depends on the level of vitamin D, pH, food matrix, and the calcium status of the individual taking the supplement. Serum calcium levels are tightly regulated within the body, and the parathyroid hormones signals for breakdowns of the bones to release calcium into the bloodstream. The recommended dose for calcium is 1,000 to 1,200 milligrams. There's a 500 milligram threshold within the body, so taking a supplement that exceeds that is not recommended. Splitting up a dose of 500 or more is recommended throughout the day. This study compared the effectiveness of bone density in women over the age of 40 following 3 different bone health plans. Patient with above average compliant had the greatest increase in bone mineral density. Groups with most nutritionally comprehensive plans outperformed others. It is recommended to stay within the RDA for calcium intake. If you're taking over the RDA, it could increase the risk of kidney stone, cardiovascular disease, ischemic heart disease, and increase the risk of prostate cancer. Calcium can also affect zinc and iron. DNIs with calcium include bisphosphates. Calcium supplements interfere with absorption and take at least 30 minutes apart from one another to prevent interaction. These are 4 high-quality brands of calcium. Look for supplements that contain a 500 milligram dose so you don't exceed absorption levels. As we know, calcium comes from many food sources, such as dairy products, leafy greens, seafood, legumes, blackstrap molasses, and fortified foods. Aim for calcium intake from whole foods, but a dietary supplement that includes calcium, we are giving it a green light, as long as it does not exceed the RDA. There are several groups at risk for a deficiency. Next is magnesium. Magnesium also comes in many forms, such as oxide, sulfate, malate, and citrate. Oxide is the most common and most economical, but may cause diarrhea. Magnesium chloride or citrate are better absorbed. You should always take magnesium in a 2-to-1 form or 1-to-1 ratio with calcium. It is effective for constipation, dyspnea, seizures, and hypomagnesia, and may be effective for heart health, asthma, cerebral palsy, chronic fatigue syndrome, and diabetes. But today the focus is going to be on bone health and osteoporosis. You can typically absorb about 30 to 40% of a magnesium supplement. Magnesium stimulates the hormone calcitonin, which helps preserve bone structure by drawing calcium out of the bones and soft tissues back into the bones. This action helps lower the likelihood of osteoporosis, some forms of arthritis, heart attack, and kidney stones. This study showed the effectiveness of a magnesium supplement. Lower magnesium intake is associated with a lower bone mineral density of the hip and whole body. The women in the study that had a higher supplement of 400 milligrams per day showed an increase in their bone mineral density. In this study, young women were given a 150 milligram supplement of magnesium oxide. This study improved their bone mineral density significantly. The participants in this study had excellent compliance. Magnesium is likely safe for adults, children, and pregnant/lactating women when used orally. It's possibly unsafe. It reaches above the upper limit and can cause diarrhea and loose stools. Magnesium toxicity is very rare in healthy individuals. Be aware of the DNIs with bisphosphates. It decreases the absorption of magnesium, so make sure you take them separately. Also can interfere with antibiotics, anticoagulants, and calcium channel blockers, which would prevent calcium from being absorbed. These are 4 high-quality brands of magnesium. Forms of magnesium supplements that dissolve in liquid are more bioavailable than soluble forms. Magnesium food sources include leafy greens, nuts and seeds, whole grains, legumes, and fish. Aim to take magnesium from whole foods, but overall, magnesium supplementation has a green light. Just ensure you're not exceeding the upper limit and try to take a supplement that meets the standards of the RDA. Thanks for listening, everyone.